Southern Nevada is currently facing some of its most challenging economic times. The Health District's Rosanna Silva-Minnick is here now with a look at how the economy is impacting the district's nursing division.
Brian, one of the areas traditionally associated with public health is community nursing, a tradition which is very much alive and well here at the district, but it is seeing some increased challenges.
We certainly see the demand in our caseload for more services. We are tending to see, not that we're seeing larger volumes of people, but more severity of the acuity of some of the situations as it relates to child abuse and neglect, or people neglecting their own health issues until they're much more significant because they're waiting as long as they can to take care of issues.
One of those health issues that is dangerous for a community to neglect is early childhood immunizations. Our statistics in Nevada are improving slightly. However, there is a real need to understand the critical importance of immunizing against preventable disease.
I think when your immunization rates as a nation are very high and they the diseases become less evident, you start lulling yourself into a false sense of security. And I think what happened in California is a very good example of that. Having 9 infants die last year from pertussis, a needless death, because of people making choices due to the publicity that was out there about warning them about vaccines and them heeding that advice. We saw a lot of families choose not to vaccinate, and what did California end up with? The worst pertussis outbreak we've seen in a very long time, and 9 children dying.
Shots for Tots addresses a specific issue in early childhood immunizations. Many new parents make sure their children receive the first in a series of required vaccines for infants, but neglect to complete the series when their child reaches a year old. Founded 3 years ago, originally with funding from the United Way, the Shots for Tots program is now a community partnership with 100 Black Men of Las Vegas, the Latin Chamber of Commerce, the Filipino Medical Association, and others to address this unique health need.
So our first year, we partnered with the 100 Black Men of Las Vegas. They were our first partner. And what they did for us is that the whole idea was for them to go to the very high-risk African American groups of the kids that we can't seem to get. There's 0 to 3-year-olds, you'll find them at their parents' home, at their doctor's offices, at WIC, at Medicaid, at child care centers. But there's that high-risk group in their parents' house that do not go to the doctor, that do not go to a child care center. So those were the high-risk groups that the 100 Black Men were targeting in order for us to immunize those kids. On the second year of our Shots for Tots, Latin Chamber of Commerce came in with the same role that the 100 Black Men is doing for the African American. The Latin Chamber of Commerce will be doing that for the Hispanic community. And then with the Filipino Medical Association of Nevada, what happens is there's a lot of Filipino doctors that are just, their practices are within the high-risk groups. The Filipino Nurses Association, one of their vision, mission, and goals is to keep the community healthy. And because they're nurses and the vision for the Shots for Tots coincide with what they represent, majority of them, during our clinic time, they volunteer their times and their services so that when we have clinics, we have more nurses to give shots and the waiting time is less because of the volunteer time given by the different nurses.
Information on Shots for Tots clinics can be found on our website, snhd.info, or by calling 759-0850. The Health District also has another immunization-related project, the Workplace Vaccination Program. Sometimes the youngest members of our community can only be protected by all of the adults being up to date on their shots. And since, particularly for small businesses, healthcare coverage may be too expensive, the Workplace Vaccination Program has been established to help employers offer cost-effective shot clinics for their employees through the district.
It's normally for small businesses that we have, the mom and pops, that they don't have enough money to send all the employees somewhere else. We have a program that's affordable, and we have a nurse and a clerk that will go and will give you your hepatitis A, hepatitis B, measles, mumps, and rubella, and your Tdap at a very affordable prices. These are for businesses with less than 50 employees, and all you need to do is call our Workplace Vaccination Program.
Information on the workplace vaccination program is also available on our website. While you're there, you'll also notice that many of our offices are now offering extended hours. And our East Las Vegas office has moved to a new, larger space at its location on North Nellis Boulevard. Brian?
That's our time for today. Be sure to join us again for HDtv Health District Television, when we'll continue our celebration of 50 years of service, in addition to keeping you current on all the happenings at the Southern Nevada Health District. I'm Brian Gresh. Thanks for watching.